Hi, my name is Kayla Perry, and today I'm going to talk to you about shingles. Shingles is caused by the Varicella Zoster virus, the same virus that is responsible for chickenpox. It is a member of the herpes virus family. Shingles occurs in individuals who have had the chickenpox virus earlier in life. After suffering from chickenpox, the virus remains dormant in dorsal root ganglia of spinal nerves and reemerges as the Varicella Zoster virus later, usually after age 50. Scientists are unsure why the virus reoccurs, but have been able to show that it does remain dormant within the body. Most at risk of developing shingles are older adults and immunocompromised individuals. About 1 in 3 U.S. adults will get shingles in their lifetime, and a person can suffer from shingles more than once. The risk of contracting and suffering complications from shingles increases with age. The genetic makeup of the Varicella Zoster virus is with double-stranded DNA. The virus has an envelope with spiky glycoproteins that bind to host cells in the body. This spiky outer layer allows the virus to move seamlessly through cells and motor neurons. The capsule protects and has glycoproteins that target sensory nerve cells in the body, which then results in itching, tingling, and other symptoms. The capsule also protects the virus from phagocytosis, allows the virus to attach to the host, and allows glycoproteins to penetrate the host membrane. The transmission of shingles is through a human reservoir. Shingles is not transmitted from person to person. A person with active shingles can spread the chickenpox virus to an individual who never had the chickenpox virus or who never had the chickenpox vaccine. So in other words, a person who is suffering from shingles can spread the chickenpox virus but cannot spread active shingles to another individual. The chickenpox virus is transmitted by airborne droplets, and 99% of U.S. adults born before 1980 have had chickenpox. This puts them at a great risk of suffering from shingles, and as you can tell, this is a large percentage of the population. Shingles is spread when the rash is in the blister phase, and this is the point at which a person suffering from shingles can spread the chickenpox virus to a person who has not previously been exposed. Shingles is not infectious during the prodromal stage or after the rash has scabbed over. You can see here in this image at the right that the varicella virus remains dormant in nerve cells after experiencing chickenpox. A weakened immune system causes the virus to reawaken and results in a burning or skin sensation. A person then develops blisters that fill with pus, and this is again the contagious stage. The blisters then crust over and heal, but can result in lasting nerve damage, as will be discussed in future slides. The initial signs and symptoms of shingles are chills, headache, fever, sensitivity to light, general feeling of being unwell, weakness, stomach ache, nausea, and itching or tingling on one side of the body where the rash will later emerge. The advanced symptoms of shingles are a painful blister-like rash on one side of the body or face. This is one of the telltale signs of shingles is, as you can see on the right, a rash in a horizontal or vertical strip on only one side of the body. The rash scabs over in 7 to 10 days and clears up completely in 2 to 4 weeks. Some of the more serious and advanced symptoms of shingles are eye problems, loss of vision, permanent pigment changes on the skin, and scarring. One of the greatest complications associated with the shingles virus is PHN, or postherpetic neuralgia nerve pain, where the rash was located. This pain can be severe and debilitating and lasts anywhere from weeks to years after the rash has resolved, and this is due to damage on the nerves where the rash was located. 10 to 13% of people who had shingles suffer from PHN, and the majority are older adults. Other rare complications of the shingles virus are pneumonia, blindness, encephalitis, or death. The treatment of shingles is really to limit the length of the infection and also the severity. So one may take antiviral medications. They will take analgesics to limit the pain, use wet compresses, calamine lotion, and oatmeal baths for itch relief. So similar to chickenpox, treatment is aimed at decreasing the itching, which can result in scarring and nerve damage. The best way to prevent shingles is to vaccinate against it. The CDC now recommends a shingles vaccine for all adults over 50. This vaccine involves 2 doses. There are 2 types of vaccines out on the market. There is the Shingrix and the Zostavax. Zostavax contains a live attenuated vaccine, and this is about 50% effective in preventing shingles. Shingrix contains the inactivated vaccine plus adjuvant, and this is 90% effective. Shingrix is a newer version of vaccine. So because Shingrix has a dead version of the Zoster virus, it also contains adjuvant, which helps your body fight off the virus better. It causes the immune system to produce more antibodies to fight shingles than the Zostavax vaccine. Therefore, your body has a stronger immune response to the Shingrix vaccine and is therefore the gold standard in what's now recommended in order to prevent shingles. Here is my bibliography. Thank you.